So, of course, we have discussed the overall mechanism. It is very good that we introduced that mechanism because what we wanted is, first of all, transparency. And we have created transparency, and that is a transparency on exports where we can be proud of. We can take pride in the fact that the European Union is one of the most open regions when it comes to vaccines and pharmaceutical products. And we invite others to join us in this openness because we know we have worldwide supply chains that have to be intact. And it is of utmost importance that we get back to an attitude where in general there is openness for export. That was point number one, the transparency that is necessary. But of course, we have to and want to explain to our European citizens that they get their fair share. And therefore, the second principle is that companies have to honor their contract to the European Union before they export to other regions in the world. And this is, of course, the case with AstraZeneca. I think it is clear for the company that, first of all, the company has to catch up, has to honor the contract it has with the European member states before it can engage again in exporting vaccines. And the third element is that we are discussing with the companies that they keep proportionality and reciprocity as a principle. The reciprocity element is something where we needed also transparency to show how much is going in different countries that are also producing vaccines, so that it is in our common interest that supply chains stay intact, that an exchange of vaccines is the normal state of play, and to have these principles in place. Again, those companies who do deliver, those companies who honor their contract, these are the ones on which basically the whole supply is relying. And therefore, for us, it's important to have a very constructive approach with these companies, to be in a constant dialogue, what we are on a daily basis, to make sure that we deliver to the European citizens, but that we also deliver to the world.